My name's Kelly. I'm a CBT therapist and forensic psychologist, and also a DPsych student. And today I'll be going to be talking about supervision. So I'm going to be talking about a model of supervision that I often use and thinking about how supervision can be used most effectively from both a supervisee and a supervisor's perspective, as I take the role of both. And I thought it would be helpful to share. And if you like the content of my videos, please make sure you subscribe to my channels, as I have weekly videos coming out. So supervision, it is a core feature of what we do as psychologists and also as CBT therapists and many other professionals. And one of the modes or the models of supervision that I find that I use probably the most is a CBT structure. So what does this actually mean? So within CBT, cognitive behavioural therapy, we set an agenda in therapy, and likewise in supervision, we also set an agenda. So agenda items can be standing agenda items, so meaning that they repeat supervision session after supervision session. Some examples of the ones that I have are well-being. I think it's really, really important to bring that into supervision. Yes, supervision is not a therapy session, but it's also really important for us to understand how we're doing and potentially how that could impact upon our practice, because if we're ignoring that or we're not acknowledging that, we don't know the kind of the impact that that could have. So you have your standing agenda items, and then you have agenda items that both the supervisee and potentially the supervisor may present with. So it could be about particular cases, it could be about a particular assessment that you're doing as a supervisee. As a supervisor, it may be that you are checking in with past agreed pieces of work and how they're getting on, or even potentially just checking up on some cases that had been previously discussed, or anything maybe from previous supervision sessions that you want to just go back to and see how things are progressing. So you've got your agenda set together, and then you may, if you want to be even more structured, is assign a time frame. So in supervision, you generally have an hour in individual supervision. It should be, depending on where you are at in practice, in your kind of career journey. It could be weekly, it could be bi-weekly, as in fortnightly, it could be monthly, or it could be less frequent than that. But I wouldn't recommend going any less frequently than monthly at any stage of your career. But normally earlier on in your career, you'll have it more frequently, and as you become more established and more experienced, that changes to it to be less frequently. So within that, so you've got your agenda items ready, and you can assign the time frames of what. So you may do 5 minutes on well-being, you may do 10 minutes on a particular client. So you do it for about, as I said, an hour. And depending on maybe how frequently you have it, could depend on how long you're going to spend on each section. But agreeing that with between the supervisee and the supervisor, and remembering that it is a collaborative relationship with your supervisee and your supervisor. And often at the beginning of your supervisory relationship, you would have agreed a contract between you, but that's probably something for another video. But yes, you have your agenda, you've got your agreed discussion points, and something that is really, really helpful and I think is key for both parties is to make sure you prepare for the supervision. I always ask my supervisees to come with a question, because when you come with a question, you've already started to think about what it is that you actually want to gain from supervision, rather than it being a long-winded and not really focused conversation. Having a question allows it to be really targeted and really clear. For example, it could be, how do I manage X's therapeutically disruptive behaviour? Or it could be, which model of anxiety is most suitable for this client? Or it could be, how do I understand this person's offending behaviour? Or it could even be, how do I manage my own emotions when client X is saying X to me? So it can be really quite specific like that. So having that question in mind is going to help you as a supervisee to think about, okay, what are you going to actually be able to get out of this? So you've done your preparation work and you've done your agenda, and as you, within supervision, you just go through it, you just ask the questions, and being aware that you will get feedback on your practice, and the supervisor will ask you questions like, did you try that, or have you thought of that? And it's never to put you on the spot as a supervisor. It's never to make you think, oh, I should have done that, I should have said that. It's never anything like that. It should be a really supportive relationship, a safe space for you to reflect on your own practice and to develop. That's the whole point of supervision. It is to reflect, to develop, to be able to hone your skills and improve your practice. So you're going through the agenda items, you're being able to ask questions, reflect on things. It may be that the supervisee will give you certain things to go and actually try out with the client or with yourself in practice. And then at the end of the supervision session, you will agree upon some action points. So thinking about, okay, so this has been the discussion, which is great. What am I actually going to take from this? So making sure that if your supervisor doesn't ask this, thinking of it to yourself. Okay, so what am I going to take away from this? Maybe what are my take-home points? What are the kind of the key points that stood out to me? And also maybe thinking of any action plans. So we discussed that when I go into a session with X, that I would be mindful of potentially where I sit in session or the time of the day it is, or I will be using this model. So making a note of what you're actually going to do, because your supervisor may come back to you in future sessions and check in with that. But likewise, you can also write things down, put them into action, and then bring them back to supervision if they did work, or even if they didn't work, being like, okay, I tried this, but it didn't quite work. What else can I do? As I said, it is a supportive, a reflective space that is for you to develop your practice. So that is supervision. There is so much that I could talk about supervision. So if you do have any questions specific to supervision, the supervisory practice as a supervisor or a supervisee, then please drop that in the comments. I'd love to be able to support people's journeys, because I think supervision is something that is incredibly important and something that we need to have, whether we are a psychologist, a CBT therapist, or, as I said, another professional. I hope you found this video helpful. Please subscribe to my channel and check out my other videos. If there are other things you would like to see, then please let me know. Thank you.